Welcome to Ask the Doctor. Today's show will focus on outer beauty, including buttock augmentation, vaginal rejuvenation, acne, and the latest laser scar treatments available today. Joining us is leading dermatologist Dr. Jackie Doral from the Miami Dermatology and Laser Institute, along with Dr. Johnny Franco, plastic surgery from Miami Plastic Surgery Institute. We will be giving insight on some of the most commonly asked questions from our audience. Let's start with Dr. Franco. Dr. Franco, let's talk about buttock augmentation. Tell us a little bit about this procedure that's gaining so much popularity.
Thank you for having me. Buttock augmentation, no question, has increased in popularity in not only Miami, but throughout the United States and Latin America. And part of this is the overall improvement in a woman's figure. The Brazilian butt lift, I'm sure, is a term that has become world-renowned at this point. And the reason that that's so popular is that you can actually shape the entire figure by doing liposuction, bringing in people's waist, improving their figure, and then using that fat to increase their butt and shape. It's a natural product in which you're using their own fat for the augmentation.
What type of patients are you seeing? Who's a good candidate?
There's really a spectrum of people that can be treated, and it's really two age groups. It's the young 20-year-olds that maybe weren't given the shape that they would like, and they do tremendously well. The other age group is the moms who've had children, and now it's time to do something for themselves.
And we see a lot here in Miami where the show is a lot of things that go into the buttocks that are not good. So I always tell patients, you want a board-certified plastic surgeon to do this procedure. What kind of adverse events can happen if you're not going to the right physician?
No question. Unfortunately, we see a lot of mishaps, and some of it's made the national news already, of illegal stuff injected into the buttock. At least once a day I have the question of, what if I don't want to use my own fat? What other stuff can I do? And silicone, biopolymer, other materials, most of the time patients don't know. And unfortunately, last night I was in the hospital treating a patient who got some illegal injection. She thinks it's silicone, but she doesn't know. And it's a lifelong problem for patients of treating this.
I think that's the scary thing, is when you don't know what's being injected into your body, that's a real problem. You really need to ask.
Remember the cement episode that we had made national news for Miami, so you've got to be careful.
No question. Research your doctor, ask them questions, and don't just ask if they're board certified. Ask them if they're a board certified plastic surgeon or dermatologist. Make sure that they actually are trained in what they're doing. You've got to be your own advocate as well.
And then I think the last question on this is, what age group are we coming into? Are we 20-year-olds getting the buttock augmentation?
It's really all across the board, everything from 20, I think my oldest patient has been 60. Really anyone that has some fat in unwanted areas and would like to improve their figures is a good candidate. It's amazing.
We all have fat somewhere. I can find it.
It's a love-hate relationship with fat, no question.
All right, well that's great. Let's move into a second topic, vaginal rejuvenation. I think most of us aren't aware of what this is and what can be done. Dr. Franco, tell us about vaginal rejuvenation.
That's a great question, because vaginal rejuvenation is this black box term that we don't really know, and unfortunately physicians use that term interchangeably. Typically, vaginal rejuvenation means improving the overall appearance of that area, and there's a couple ways to do that. It's really affecting the labia majora, which is the outer portion of the vaginal area, and then the labia minora, which is the lips and the inner portion of the vagina. And this has really become popular as grooming habits have changed. You guys have probably seen it in your practice, laser hair removal,
Absolutely.
different grooming practices. Now is indigo bare, and so people can see the differences. And so when they're standing in front of a mirror, they don't want to see stuff hanging down, and so they like that tied in, trimmed, and improved.
So are you saying that there's certain areas that, for instance, maybe the labia minora can hang a little bit lower than the majora, and that's what people are usually approaching you about, or is it anything and everything?
It's anything and everything, but that is by far the most common, and it can be in a 20-year-old that just has that from birth, to a mom again that wants to retighten stuff, because no question we lose volume everywhere. As you commonly see in your facial patients who need volume. The same thing is true for that areas. And so a lot of times I'll take fat as well from the abdomen, flanks, any unwanted area. You can fill the majora so that looks more youthful, because women can lose fat down there with age as well, and then retighten those lower lips so that when they stand in front of the mirror, it looks a nice smooth contour.
Do you have any advice for patients who might be embarrassed about approaching you for this procedure, or don't know where to go?
No question. Even in my office, the majority of the questions come to either my assistant or my patient care coordinator first, because there is some lack of knowledge and even where to go. And I think, no question, again, going to a plastic surgeon that's board certified is a good source, a good resource.
And another good source is Ask the Doctor. We're going to take a quick commercial break, and we'll be back in a moment.